Hi friends, this is Dr. Balakumari. One of the most beautiful and the most useful inventions that happened in our field is ultrasound scan. It changed the way we treated the patients. Imagine 40 years ago, we could hear only the heartbeat with what is called as a Pinard's fetoscope. Now we are able to see the fetus inside, moving, able to find out abnormalities and the well-being of the baby. Isn't that wonderful? Let us see about the first scan that we do in pregnancy today. What is scanning? Scanning is assessment of an individual or an object by your eyes, camera or an machine. The ultrasound scan that we do in the pregnancy, what does it do? It sends sound waves into the body of the woman. The sound waves hit different objects. It can be a fetus, it can be a swelling, it can be fluid, and then gets reflected back. The reflected sound waves are producing images depending upon the object which it hits. If it's a bone, it's bright white. If it's fluid, it's dark. If it's a soft tissue, it's gray in color. So the ultrasound machine produces these sound waves as images which we see as scan images. Is it safe? The ultrasound have been in use for about 40 years since its invention, and there have been no bad effects because of the ultrasound, even if done very repeatedly. So it is very safe. X-rays we don't take during pregnancy. When should the first ultrasound be done? We prefer to do between 7 to 8 weeks of pregnancy from the last menstrual period. Last menstrual period is the milestone that we know for sure. So the gestational age of the fetus is calculated from the last menstrual period. Why can't you do early? Won't it be seen? Actually, even at 5 weeks, we may be able to confirm the pregnancy if the woman has a regular periods. But we may not be able to see a heartbeat. To see a heartbeat, you have to do another scan. To measure the length of the fetus correctly, you have to do another scan. You may have to do too many scans if you do too early. So it will be better to wait till 7 to 8 weeks if you do not have any bleeding or lower abdomen pain or any previous history of ectopic. It's good to wait till 7 to 8 weeks and have your first scan done. This we usually call a dating scan. That is because this is a time when we will be able to measure the fetus accurately and predict the delivery date. The length of the fetus is called crown rump length, and that tells you how many weeks the fetus is. Between 7 to 8 weeks, it is large enough to measure and it doesn't move. It is difficult to measure a moving object. What ways can we do the scan? One patient came to me, "Doctor, don't do a vaginal scan for me. I just don't want to do, because one of my friends aborted after a transvaginal scan and one friend had an ectopic. This is something like, I had an ice cream yesterday and today I have fever." Ice creams you take so many times, but you also happen to take an ice cream the day before you developed a fever. It is something like that. It doesn't actually cause abortions, but it can detect if there is a missed abortion or an abortion happening or an ectopic pregnancy. In a transabdominal ultrasound, we have to go through so many layers. The thickness of the abdominal wall, if it is more, the images will not be very clear and our view is restricted to 180 degrees. Whereas when we do a transvaginal ultrasound, our view is around 230 to 40 degrees we can see. So a transvaginal scan in early pregnancy is more accurate and it is definitely safe. You really don't have to worry. One patient came to me, advised her an ultrasound scan, but she said, "Doctor, I don't want to have any scan now. Okay, I will do at the end of 3 months," which is fine. Then after examining her clinically, I told her all these physical examination is fine. Then she asked me, "Is the baby good?" I said, I really cannot say about the baby, because by palpating the abdomen before 3 months of pregnancy, I will not be able to come to any conclusion. We need an ultrasound to say whether the pregnancy is normal. What are the informations you get in a first scan or a dating scan. It confirms whether the pregnancy is there, and it tells you whether it is in the uterus or outside the uterus, whether it is a single fetus or twins or triplets, and it tells you whether it corresponds to your dates, the dates that you have given us. Especially if your periods are irregular, this is very helpful to assess the age of the fetus and your delivery date. It tells you whether heartbeat is present or not and whether it is normal. So much wealth of informations we get in the first ultrasound, that is preferably by a transvaginal ultrasound. One patient came to me. She said, I'm 7 weeks 5 days pregnant. The scan shows only a 7 weeks fetus. Why is there a 5 days difference? So I did a scan. It was 7 weeks 4 days. Then I told her, supposing you have an object like this. If you see this way, the length is different. Supposing you see this way, the length is different. Supposing you see this way, the length is different. Depending upon the way you look at the fetus, the length will vary. It may vary for the same person in the morning and evening. You can't tell the fetus, hey, I'm taking a scan, give me a proper pose. You can't do that, right? Similarly, you can't go all around 360 degrees and take a picture. So, scan has its own limitations. If there is a difference of 5 days or less in the first scan from your dates, you don't have to worry. So, friends, a transvaginal ultrasound taken in the first 7 to 8 weeks of pregnancy is absolutely safe and gives you a lot of information. Do not hesitate to undergo. Thank you. We'll see you in the next video.